The first thing is that I believe that the rural areas are the high-hit poverty zones. And there's a need to have adequate medical facilities. There's a need that the government should partner with people, organizations, both internal and externally, to make sure that the rural areas are highly improved in terms of health facilities. Not only that, but pastors assigned within the rural areas should have some sort of training. It could be that medical practitioners could go in and conduct 3 months or 1 month or 3 weeks or whatever seminars there to equip the pastors within the rural areas and to make sure that when they are faced with such situation, they will not just limit the people only to the spiritual working of God, but they will advise the people and so that they should seek medical attention. The second thing that I will also propose is the fact that there must be health course for pastors in training at Christian seminaries and university within my country. At the African Methodist Episcopal University, where I lecture, we came out at Bryan Theological Seminary within the university to develop what we call ACE seminar, or HIV and AIDS seminar. And then we run that course over a semester. And so that pastors that are at Bryan, that are in training there at the university, will make sure that they have at least some sort of knowledge in relation to HIV and AIDS preventive method. And I believe that there is consideration in the area of preventable and treatable diseases as well. We should develop a model at least for 16 weeks or so within the universities and Christian seminaries to help our pastor, most especially within the context of Pentecostal and charismatism. Lastly, and what Dr. Pelling, and lastly, and then what Dr. Pelling just said, that there might be partnership between organizations of health initiatives, both within Liberia and out of Liberia, to resource the program in order to have an effective result. Because in terms of what we have back home, coming from our 14 years of civil conflict that claimed over 200,000 lives, it is clear that the infrastructure are down. And people like one of our presenters this morning, who was with the SIM mission, and that is the ELWA hospital in Liberia, can attest to the difficulty in terms of medical facilities there. It is clear that within, we can't make it alone. We need external help as well to resource the health facilities within the country. And so then there should be a holistic approach to the whole issue in terms of the partnership issue on health delivery in Liberia. And to conclude, I believe that this is an opportunity that we can network and to continue what Christ did, not just ministering, spiritually, but also meeting the physical needs of the people. Thanks.
Good afternoon. I am Latasha. Oh, thank you, because I'm looking for my display button. Oh, perfect. It's good to be here this afternoon, and I feel really great to be on a panel with Dean and Pastor Daniel. It's in my field of finance. It's interesting to come into a place where I can actually speak about my faith and finances at the same time. So that's a wonderful place to be, particularly since Pastor Daniel, I am an ordained AME minister. So it's nice to share a situation with an AME minister and that we are not at an AME annual conference. So it's nice to be in a public setting. Today, I want us to look at stewardship as a tool to build capacity while improving sustainability. We have actually had two wonderful presenters before us, and I don't want to worry your patience too long, but they have completely given you some wonderful examples of what I'm going to speak about. As Christians, when we think of stewardship, the Merriam-Webster dictionary defines it as the conducting, supervising, or managing of something, especially the careful and responsible management of something entrusted to one's care. Many times in the church, we look at stewardship as financial, but it's not just financial. Stewardship takes us into those 7 principles of time, talent, resources, nature, worship, relationship, many of the pieces that my prior presenters have given you specific examples of. But I want us to look at stewardship in context of health, lifestyles, and Christian values. That when we are working on programs, we need to be mindful of our Christian value, the value that we hold within our organizations, and that we need to use that within the 7 principles of stewardship. So we look at time, treasure, relationship, talent, temple, worship, and nature. The first thing that came to my mind was train yourself in godliness. For while physical training is of some value, godliness is valuable in every way, holding promise for both the present life and the life to come. We are held to a higher standard as Christians. As noted before, when we look at time, time is such a valuable commodity. Christ spent and gave his time freely. Christ spent many hours teaching and preparing those that he came in contact with. And when we think of the concept of treasure from the biblical standpoint, we note that God, in Jesus' Sermon on the Mount, he talks about where your treasure is, that there is value, and there will be your heart. Where our treasure is, as Christian, faith-based organizations, is in our faith. And there, because of our faith, we should be able to make sure that we don't just abide in our faith to those who we serve, but that we use our faith to help them understand that the talents of a doctor are very well received and can help you just as much as the talent of the pastor. And so this is where we start to apply the concept of your talent, that special gift that you've been given. Many of us have been given various talents. Some of us teachers, some of us preachers, evangelists, and some of us have just been given organizational talents, having interpersonal skills, being able to talk with others, being able to go into the field and not only provide a physical service, but to provide a spiritual service as well. That I'm not just here to serve you because I've been given a grant or because it's the mission of the organization, but because based on our faith-based value, I really want to see you improve and move forward. I don't want to see you go back to that same old place where you were, but to grow in your education and in your knowledge and understanding of health issues, in your knowledge and understanding of proper educational values and tools. I want to make sure that as I come into this setting and I come to serve you, that you realize I'm truly here to serve you and that it's based on my Christian values and beliefs. And so then we look at the temple. And we were mentioning this earlier. We are workers, and workers that we are, having given of all our time, the time of lunch, the time of morning, the time of evening, the time of the midnight hour, burning the oil, overburnt the oil, that there's a self-care aspect, that we are not able to fulfill the mission of an organization, take care of our families, or take care of ourselves if we're burnt out. One organization I knew of, they had 2 weeks vacation, and they made sure that by the 6th month in the calendar year, everyone in their office had to have taken at least 50% of their vacation time. And then they had to have planned when their next vacation would be. As much as we want to just continue working and serving, we have to realize that if we don't take care of ourselves, then we aren't being good stewards of what God has given us. God's given us a lot, but we have to make sure that we use that wisely so that we're able to work with our partners and to really be of value. I don't know about you, but in the morning, if I haven't had my Starbucks or some kind of coffee, caffeine, tea, I'm not valuable until I've had that morning drink to kind of pick me up. And that's usually really because I've been burning the midnight oil the night before. And so therefore, I'm trying to find some kind of stimulant to just keep me going in the morning. But if we take our time and are well rested and really taking time and good stewards of our own self-care, we won't have that problem because we'll be adept and ready to go in the morning and thinking our way through the day and not just drudging along trying to figure out how can I make it to the next nap or the next break. When we look at worship and the Christian context of how we work, some of us are able to have worship services and some of us aren't. But we need to be connected. If we're going to call ourselves Christian faith-based organizations, then we need to stay connected with God. We need to spend some kind of time in worship, prayer, devotion, be it 5 minutes before you turn on the computer, in the car, but we need to nurture that. And we need to understand the biblical values and principles. Many times when you're trying to convince a pastor that they shouldn't be just anointing someone, that they need to understand that God gave the talent to that doctor to study 7 or 10 years, learn a particular specialty, and now that doctor has been gifted and can help heal you, give you the right medicines, help move you along in that process of care. And that's what we need to understand and use the skills and the tools that we have before us. I think that many times in the faith-based community that we do not always share the gospel in that practical context when we're working. We're just so involved in the work that we don't take time to maybe look up the scriptures that will help reinforce the lesson that I'm trying to teach today, or that will give me some kind of conversational tool when I'm having this conversation about family wellness, that I can use those. And particularly in an African context, having taught in a Bible college in Ghana myself, it does help. It helped us when we had an outbreak of what we call pink eye. And so there was a major outbreak on the campus. And in my conversations with students, I was informing them that God calls us to be good stewards, caretakers of what he's given us. And your body is something that he's given you. And therefore, we need to also be hygienic in how we manage through this crisis on the campus. And then we have nature, that we have resources, natural earthly resources that we need to be overseers of, that we're called to be the caretakers of, and we need to really do that. We've started that now. There's the big push in the global world that we live in, and being recycling and ergonomically correct in our offices and those types of things, and that's what we should do.